Good day, panelists, CIs, and classmates. We are the Group 3B, and today we will present our research entitled The Live Experiences of Hospital Nurses in the Use of Personal Protective Equipment. I am Renzi Lobaton.
I'm Steven Ashida.
My name is Enrico Olivar.
I am Leslie Loredo.
I'm Sean Milabo.
And I am Christopher Montabon. Background of the study. Personal protective equipment is necessary to prevent nurses from contamination when exposed to pathogens. PPE limits interpersonal skills and personal necessities. Nurses are at a high risk of compromising their health and have lesser productivity. And Leibner et al. State that discomfort, headaches, and impaired visibility are some of the negative effects of PPE use.
For the statement of the problem, the study aimed to explore the lived experiences of hospital nurses in the use of personal protective equipment.
Significance of the study. This study may be beneficial to the following such as Department of Health, hospital institutions, nursing administrators, nurses, and lastly, future researchers.
For the theoretical framework, the study was anchored to Rosenstock health belief theory. Four dimensions includes perceived barriers, severity, susceptibility, and benefits. Health belief theory was used to analyze the beliefs, attitudes, and reasons for health workers in adherence and compliance in the use of PPE.
For conceptual framework, in relation to the health belief theory of Rosenstock, the researchers came up with an input of the demographic profile of the nurses in terms of age, sex, and area of assignment. The researchers then interviewed the lived experiences of participants in the use of PPE. For research design, this study employed a qualitative research design and phenomenological approach. The design and approach were used to provide meaning to the experiences of the hospital nurses in using PPE.
Participants of the study. The researchers targeted the nurses working in the emergency room, operating room, and COVID-19 ward where PPE is necessary. Non-probability purposive sampling method was used, and researchers arrived at a total of 6 participants for the study from public and private hospitals. Inclusion and exclusion criteria were the following.
Methodology instrument. Qualitative data collection tools were used. Virtual interviews were conducted with a set of guide questions. The interview encouraged active interactions for answers related to lived experiences. Respondent validation was used for a consistent transcription, and full access to the narrative process certified reliability of the study.
For the data gathering procedure, the researchers first identified nurses working in the hospital, gave a letter of permission, gave consent to the nurses personally, oriented the participants, conducted a virtual interview, and set another meeting with the participants to validate the data gathered.
For the data analysis procedure, the interpretive phenomenological analysis or IPA was used in the study. The Creswell 6 steps are the following: data collection, transcription, reading through the data, coding of data, coding for description, and lastly, coding for themes and categories.
For ethical considerations, the principles of autonomy, beneficence, non-maleficence, confidentiality, and justice were observed in the study.
Results and discussion. Through the thorough extraction, deduction, and analysis of the transcriptional manuscript, 8 main themes were identified. The profile of the participants. All participants were female with age range from 24 to 30 years old. First theme identified is physical experiences with categories. First, head problems as stated by Nurse Rain. Prolonged use of PPE makes me dizzy due to the lack of oxygen. Next is impaired sensation as stated by Nurse Rain. If this difficult because when you insert IV and it fogs, it is hard to see. If you are on hazmat, you are inaudible and you cannot hear. Next is breathing difficulty, as stated by Nurse Shane. When using N95, you get suffocated and you will have difficulty of breathing. Next is risk for self-care deficit, as stated by Nurse Shane. You cannot eat, you cannot drink water, you are prone to UTI, and you are prone to low sugar intake. Next is musculoskeletal problems, as stated by Nurse Rain. I usually experience headache at night after dawning as well as back pain. I feel weak in lower extremities and sometimes I have tremors. Next is heat stress, as stated by Nurse Rain, especially in operations where you are having excessive diaphoresis. Next is exhaustion. Nurse Dane stated that it is draining since the sweat from using 3M, especially in longer hours. Next is discomfort, as stated by Nurse Jane. You cannot move well. Lastly, adaptation and comfortability, as stated by Nurse Jane. I am making my work done at a slowed and normal pace. In PPE comfortability, I can say that it is 8 to 9 over 10.
The second theme is the emotional experiences, with the first category of displeasure, as stated by Nurse Dane. From time to time, I get angry, tired, and complain. Next is fear and anxiety, as stated by Nurse Dane. I feel scared even while on PPE. Next is acceptance of the situation, as stated by Nurse Dane. Now you have to enjoy your work. Next is determined, as stated by Nurse Rain, to fulfill my duties and responsibilities and to serve those who are in need despite of PPE use. And lastly, feeling secured, as stated by Nurse Main, give me a sense of security because I am aware that I am protected.
The third theme is mental experiences. The first category is compromised alertness. As stated by Nurse Rain, sometimes my alertness is affected because I'm thinking of my PPE struggles. Next is mentally prepared. As stated by Nurse Main, I always try to stay in focus and be alert while on PPE. Next is thinks positively. As stated by Nurse Main, I try to think positively and take things in a constructive way. And lastly, makes critical decisions. As stated by Nurse Rain, it hasn't upped my decision making to lessen my exposure but securing efficacy and to save time and effort.
For the fourth theme, social experiences. The categories includes difficulty in communicating, as stated by Nurse Jane. It's just that with PPE, we cannot understand and hear each other because of the mask. And the last one is strong relationship and support system. As stated by Nurse Dane, I think that the most important value is the support and understanding.
Spiritual experiences 5A, praying, hoping, and asking for guidance. Significant statement by Nurse Shane, while using PPE, you pray for no breach because it is frightening. Also by Nurse Rain, if I am experiencing difficulty breathing or doing tasks, I ask God to be with me and guide me.
For the next theme, the nurse performance. The categories includes altered nurse performance, as stated by Nurse Shane. We don't have enough stocks of PPE, so we can't urinate or defecate. You get hungry and also you feel weak. The last one is compromised nursing care. As stated by Nurse Dane, it affected my performance in delivering care. Now, with the use of PPE, the physical aspect is not working fast.
For the seventh theme, which is improvisation of PPE during scarcity, under the first category, which is improvised materials used to supplement PPE scarcity, as stated by Nurse Dane, we used a disposable gown and a raincoat for the second layer. For the next category, which is improvised disposable gown, as stated by Nurse Jane, outside the COVID ward, aside from the lab gown, there is also a disposable gown. And for the last category, which is improvised face shield, as stated by Nurse Rain, the use of improvised face shield with the use of plastic folders. For the eighth theme, which is utilize PPE, under the first category, which is level 2 PPE for suspected COVID-19 patients, as stated by Nurse Shane, we are using level 2 PPE, which is composed of 2 hair cap, an N95, surgical mask, goggles, face shield, disposable gown, 2 pairs of gloves for inner and outer, apron, shoe cover, or boots with cover. And for the last category, which is level 4 PPE for confirmed COVID-19 positive patients, as stated again by Nurse Shane, we are using level 4 PPE, goggles included, hair cap, N95, 2 surgical masks, 2 pairs of sterile gloves, inner outer, clean gloves for skin-to-skin contact with the patient, an apron, and boots with shoe cover.
In conclusion, somatic strain, heat stress were the most common complaint of the nurses. Discomfort and fear can be explained in a nurse's trust in PPE that any time it could break or malfunction. Mental pressure for nurses is created whether to hesitate or be mindful of their every move in performing their duties. Alertness often displayed with compromised decision making, less focused, and impulsive with the threat of acquiring the virus. Misunderstanding is common among nurses since with the deep covers of PPE they could hardly hear each other. Nurses seek spiritual support and guidance when performing difficult tasks and gives a positive outlook to get the job done despite of the experiences brought by the use of PPE.
Also, the nurse performance is altered because of PPE. Simple procedures were only done for minimal exposure. Improvised materials brought discomfort since most of it were plastic bags and second layer of face mask to preserve the N95 and avoid cross-contamination. And the use of PPE depends on the area and the condition of the patient.
For the recommendation, hospital enlighten institutions for the improvement of their mandated rules and regulations to the use of PPE. Nurses should prepare and condition their bodies prior to their shifts. Manufacturers ensure the quality, availability, and meet the demand of supply. For DOH, allocating budget plans for a possible pandemic and securing enough stocks for every healthcare worker. Lastly, for future researchers, find new studies to improve, develop, and innovate the qualities of PPE.
Utilization. The results will be forwarded to the hospital nursing administrators and relayed to nurses for awareness. The data will also be accessible as basis for the hospital institutions and health-related government agencies in organizing plan of actions and recognizing positive and negative experiences of nurses in the use of PPE. And our references.
For the acknowledgement, the whole PSN 3A Group 3B would like to extend their heartfelt gratitude to all persons who contributed efforts and support to make this study endeavor into reality. First of all, to our Almighty God, to Dr. Shaila M. Trajera, to Dr. Leslie E. Young, to our research panels, and lastly, to the loving parents of the researchers. That would be all. Thank you.